Most people think heart disease only comes with obvious warning signs like chest pain or shortness of breath. But the truth is, your heart could be in trouble right now, and you wouldn't even know it. Imagine waking up feeling perfectly fine, only to realize, too late, that your heart has been silently struggling for years. Heart problems don't always announce themselves with dramatic symptoms. Instead, they often start with subtle, easy-to-ignore signals, things you might dismiss as harmless. A little fatigue, some leg cramps, or even bleeding gums could be warning signs of a much bigger issue. The scariest part? By the time traditional symptoms appear, the damage might already be serious. That's why catching these hidden red flags early is critical. Today, we're revealing 11 surprising signs your heart might be in danger and what you can do right now to protect it before it's too late. Be careful if you have more than 5 signs combined. Your heart is dying. Sign 1. Calf swelling or pain. Have you ever felt an unusual soreness, cramping, or swelling in your calves, especially after walking or climbing stairs? It's easy to blame dehydration, aging, or overexertion, but what if it's actually a sign of something far more serious? This could be a warning sign of peripheral artery disease, PAD, a condition where plaque buildup narrows your arteries, restricting blood flow to your legs. When your muscles don't get enough oxygen, they react with discomfort, pain, or swelling. But here's the real danger. PAD isn't just a circulation issue. It's strongly linked to heart disease and strokes, meaning your heart could be at risk too. Ignoring this symptom can have severe consequences, from an increased risk of heart attacks to, in extreme cases, limb amputation. But the good news is you can take action. Regular exercise, a heart-healthy diet, and quitting smoking can help keep your arteries clear. If you've been experiencing persistent calf pain or swelling, don't wait. Talk to your doctor. Catching PAD early could make all the difference in protecting your heart and your life. Sign 2. Bleeding gums and gum disease. Brushing your teeth and noticing a little blood? You might think you just brushed too hard or skipped flossing a few times. But what if your gums are actually warning you about your heart? Gum disease, or periodontitis, isn't just a dental problem. It's a serious inflammatory condition that can allow harmful bacteria to enter your bloodstream. Once there, these bacteria contribute to plaque buildup in your arteries, increasing your risk of heart disease and strokes. Studies show a strong connection between poor oral health and cardiovascular problems, meaning your gums and your heart are more closely linked than you might realize. So, how can you protect yourself? Start with good oral hygiene. Brush and floss daily to eliminate bacteria before they have a chance to cause damage. Regular dental checkups can catch gum disease early, preventing bigger issues down the road. But oral care goes beyond brushing. Your diet and stress levels play a huge role too. Eating anti-inflammatory foods and managing stress can help lower your overall risk. If your gums are frequently red, swollen, or bleeding, don't ignore them. Your mouth might be trying to tell you something important, and your heart is listening. Sign 3. Snoring or sleep apnea. Loud snoring might seem like nothing more than an annoying habit, but what if it's actually a warning sign from your heart? If your snoring is accompanied by breathing pauses or gasping for air during sleep, you could be dealing with sleep apnea, a condition that puts immense strain on your cardiovascular system. Sleep apnea occurs when your airway becomes partially or fully blocked during sleep, causing repeated interruptions in breathing. Each pause lowers oxygen levels, forcing your heart to work harder and raising your blood pressure. Over time, this cycle of oxygen deprivation and stress can increase the risk of high blood pressure, irregular heart rhythms, heart disease, and even stroke. Many people with sleep apnea experience daytime fatigue, morning headaches, and difficulty concentrating, yet remain undiagnosed. If you or your partner notice persistent snoring or sudden gasps for breath at night, it's crucial to consult a sleep specialist. Treatments like a CPAP machine, which keeps your airway open, can dramatically improve symptoms. Maintaining a healthy weight and improving sleep habits can also help reduce the severity of the condition. Ignoring sleep apnea doesn't just lead to poor sleep. It can put your heart at serious risk. If you snore loudly or struggle with unexplained fatigue, don't wait. Get checked today. Sign 4. Sudden extreme weakness. Everyone feels tired from time to time, but what if you suddenly feel overwhelming weakness out of nowhere? Not just regular fatigue, but a deep exhaustion that makes even simple tasks feel impossible. This could be your heart sending a distress signal. When the heart isn't pumping blood efficiently, oxygen levels drop, making your muscles and organs struggle to function properly. This can lead to sudden extreme weakness, often accompanied by shortness of breath or lightheadedness. Many people dismiss this as being overworked or dehydrated, but in reality, it could be an early sign of heart failure or even an impending heart attack. Unlike regular tiredness, this kind of weakness appears suddenly and doesn't improve with rest. It can feel like your body is shutting down, even when doing something easy. If you experience this alongside dizziness, nausea, chest discomfort, or an irregular heartbeat, don't ignore it. Call emergency services immediately. Your body knows when something is wrong. It's up to you to listen. Sudden, unexplained weakness is never normal. If it happens to you, take it seriously and seek medical help right away. Before we continue, if you don't subscribe to our channel, you'll probably never see our videos again. If you already follow us, congratulations, you are getting closer to a healthy and long life. Sign 5. Skin rashes or unusual spots. When you think about heart health, your skin is probably the last thing on your mind. But what if persistent rashes, red patches, or scaly skin were actually linked to your heart? Chronic skin conditions like psoriasis and eczema are caused by inflammation, and inflammation plays a major role in the development of heart disease. Studies show that people with psoriasis are at a higher risk of heart attacks and strokes because their bodies remain in a constant state of inflammation, which can affect not just the skin, but also the heart and blood vessels. If you've been dealing with unexplained rashes that don't seem to improve with treatment, it may be worth looking at the bigger picture. Skin conditions can be a sign of underlying cardiovascular issues, especially when paired with other risk factors like high blood pressure, high cholesterol, or a family history of heart disease. The best approach is to see both a dermatologist and a cardiologist. Managing inflammation through a healthy diet, stress reduction, and proper medical care can help protect both your skin and your heart. Your body often sends subtle signals when something isn't right, so don't ignore what your skin might be trying to tell you. Sign 6. Unexplained nausea or indigestion. Everyone experiences an upset stomach now and then. Maybe it's something you ate, stress, or a minor digestive issue. But what if that persistent nausea, bloating, or stomach pain isn't coming from your stomach at all? What if it's actually a warning sign from your heart? When the heart struggles to pump blood efficiently, it can affect the digestive system, leading to symptoms that mimic acid reflux, indigestion, or even food poisoning. Many people, especially women, experience nausea and stomach discomfort as one of the first signs of a heart attack. Because these symptoms don't always come with chest pain, they're often dismissed as minor issues until it's too late. If your nausea feels unusual, lasts longer than expected, or is accompanied by dizziness, shortness of breath, or discomfort in the chest, jaw, or back, don't ignore it. This could be your body signaling an emergency. Call for medical help immediately. Your stomach may not be the problem. Your heart might be the real culprit. Trust your instincts. If something feels off, it's always better to be safe than sorry. Sign 7. Persistent hoarseness or chronic cough. A lingering cough or a raspy voice is often blamed on allergies, a cold, or acid reflux. But what if your persistent hoarseness is actually coming from your heart? When the heart isn't pumping efficiently, fluid can build up in the lungs, leading to a chronic cough or unexplained hoarseness. This is often a sign of congestive heart failure, a condition where the heart struggles to circulate blood properly, causing fluid retention in the lungs. Many people assume their cough is just a minor respiratory issue, not realizing that a weak or failing heart can mimic symptoms of lung problems. Unlike a typical cough, a heart-related cough is usually dry and persistent. It may also worsen at night or when lying down. If your hoarseness or cough is accompanied by swelling in the legs, fatigue, or shortness of breath, it could be a sign that your heart is struggling to keep up. Early detection is key. If your cough doesn't seem to be linked to a cold or allergies and won't go away, don't ignore it. Your heart might be trying to tell you something important. Seeking medical attention could help prevent more serious complications down the road. Sign 8. Fainting spells or dizziness. Feeling lightheaded when you stand up too fast can happen to anyone. But if you experience sudden, unexplained fainting or dizziness, your heart could be the real cause. Your brain depends on a steady flow of oxygen-rich blood to function properly. If your heart's rhythm becomes irregular or if there's a blockage in your arteries, blood flow to the brain can suddenly drop, causing dizziness, lightheadedness, or even fainting, also known as syncope. These episodes can happen without warning and may lead to dangerous falls or injuries. While fainting can have many causes, when it's heart-related, it could indicate serious conditions like arrhythmia, heart valve disease, or even an impending heart attack. The key warning sign: if fainting happens repeatedly, occurs during physical activity, or is accompanied by chest pain, palpitations, or shortness of breath, it should be treated as a medical emergency. Don't dismiss fainting as a minor inconvenience. If you or someone you know experiences sudden, unexplained fainting, seek medical attention immediately. Your heart might be struggling, and catching the problem early could prevent a life-threatening event. Sign 9. Sudden or excessive sweating. Breaking out in a sweat during a workout or on a hot day is completely normal. But what if you start sweating profusely for no clear reason, even while sitting still? This could be a warning sign from your heart. When the heart is struggling, it triggers the body's fight or flight response, releasing stress hormones that can cause excessive sweating. Cold, clammy sweating without exertion, especially when paired with other symptoms like chest discomfort, nausea, dizziness, or shortness of breath, can be one of the earliest signs of a heart attack. Many people ignore this symptom, assuming they're just overheated, anxious, or coming down with something. But if you experience sudden, unexplained sweating, particularly along with pressure or tightness in your chest, don't wait. Seek medical help immediately. Time is critical when it comes to heart attacks. If something feels off, trust your instincts and call emergency services. Recognizing this symptom early could be the difference between life and death. Sign 10. Unusual or prolonged anxiety. Feeling anxious before a big event or during stressful moments is normal. But what if you experience sudden, intense anxiety or panic attacks for no clear reason? It could be more than just stress. It could be your heart sending an urgent warning. The heart and nervous system are closely connected. High blood pressure, irregular heart rhythms, and poor circulation can all trigger anxiety-like symptoms, including a racing heart, dizziness, and shortness of breath. In some cases, persistent or unexplained anxiety may be an early sign of heart disease. Many people mistake heart-related symptoms for panic attacks, especially women, who are more likely to experience anxiety, nausea, and fatigue as early signs of a heart attack rather than the classic chest pain. If your anxiety feels unusually intense, happens suddenly, or is paired with heart palpitations, sweating, or chest discomfort, don't ignore it. Pay attention to your symptoms. Practice stress management techniques like deep breathing or meditation, and most importantly, a heart checkup. Your body might be warning you about a deeper issue, and catching it early could help protect your heart in the long run. Anxiety isn't always just in your head. Sometimes it's coming from your heart. Sign 11. Decreased tolerance for exercise. Have you noticed that activities that used to feel easy, like climbing stairs or taking a short walk, now leave you feeling out of breath or unusually exhausted? If you find yourself struggling with physical exertion more than before, your heart may be having trouble keeping up. When the heart weakens, it loses its ability to pump oxygen-rich blood efficiently, leading to fatigue, dizziness, and shortness of breath, especially during movement. Many people assume they're just out of shape or getting older, but a sudden decline in stamina is not normal. It could be an early sign of heart disease, blocked arteries, or even heart failure. If you notice a significant drop in your ability to exercise, don't push through the exhaustion. Listen to your body. If simple activities feel harder than they should, it's time to check on your heart. Consulting a doctor early can help prevent serious complications like heart attacks or strokes. Taking action now could make all the difference. Protecting your heart. What you can do today. Your heart works tirelessly to keep you alive, but are you giving it the care it deserves? Many warning signs of heart disease are easy to overlook until it's too late. The good news is that you don't have to wait for a crisis to take action. Small changes today can lead to a healthier, stronger heart for years to come. Here's what you can do to protect your heart. Eat heart-healthy foods. Focus on whole grains, lean proteins, healthy fats like omega-3s, and plenty of fruits and vegetables. Cut down on processed foods, trans fats, and excess sugar, which contribute to inflammation and artery blockage. Exercise regularly. Aim for at least 150 minutes of moderate aerobic activity per week, such as brisk walking, or 75 minutes of vigorous exercise, like running or cycling. Staying active helps keep your heart strong and your blood vessels clear. Quit smoking and limit alcohol. Smoking and excessive drinking put enormous strain on your heart. Quitting smoking can immediately reduce your risk of heart disease, while moderating alcohol intake helps maintain healthy blood pressure. Manage stress effectively. Chronic stress triggers inflammation, high blood pressure, and irregular heart rhythms. Practicing deep breathing, meditation, yoga, or other relaxation techniques can help keep your stress levels in check. Get regular heart checkups. Don't wait until symptoms appear. Routine screenings for blood pressure, cholesterol, and heart function can detect problems before they become life-threatening. Your heart is your most vital organ. Treat it with care. If any of these warning signs sound familiar, don't ignore them. Take action, see a doctor, and make the changes your heart needs. Because when it comes to heart health, prevention is always better than cure. Heart disease is often called the silent killer for a reason. It doesn't always come with obvious warning signs. Many people assume they're perfectly healthy, only to realize too late that their heart has been struggling for years. But now you have the knowledge to recognize the hidden symptoms before they become life-threatening. By paying attention to the small signals your body gives you, whether it's persistent fatigue, unexplained dizziness, or even something as simple as bleeding gums, you can take control of your heart health. Early detection saves lives, and making proactive lifestyle changes can significantly reduce your risk of heart disease. If you've noticed any of these signs in yourself or a loved one, don't wait. Schedule a checkup, take steps toward a heart-healthy lifestyle, and spread awareness. The choices you make today can protect your heart for years to come. Your heart is always working for you. It's time to start working for it.